Okay. That's perfect. Sounds
good. Thank you, everybody, for coming out today. We just had a very long and I'd say eventful day and informative day with Governor Cuomo concerning primarily, but not only, the nursing home situation in New York that led to so many thousands of deaths. Look, today was very interesting. I felt like the governor was defensive throughout most of the day, often putting blame on other people rather than himself. Didn't seem to be taking a lot of responsibility for the things that were happening. You know, one of the key elements of concern that we have had through this is a directive that came from New York that said that you must accept patients and not test them for COVID before you put them back in the nursing home. I thought that was interesting because at one point he said, I think our problem was that the staff wasn't being tested. Well, they weren't prohibited from being tested, but the patients were. And you put them into a nursing home amongst the most vulnerable people, our American seniors that are in nursing homes. There seemed to be very little remorse. Often when we talk about the number of deaths that took place, they were just numbers. They were just numbers. But there were a lot of prospects, things that we want to look into further, and I think we will be looking into further. It is mind-blowing to me that the governor, who was later to rescind or amend the directive that went out about putting COVID patients or untested patients back into nursing homes. He was the one to put the executive order out to amend it. But when it came to the directive itself, he had no idea where it came from and still does not. No responsibility. I don't know where the buck stops. And frankly, it's not only with the state government in this situation. We see the same problem with our federal agencies, especially when you look with the situation at NIAID and NIH, where Governor Fauci said, I'm not the one who approves the grants, I just sign them, and your taxpayer dollars go out. Well, there's a lot of taxpayer dollars in New York as well, and seemingly a lack of accountability, so we are not finished. But I want to give a lot of credit through this whole process and the months and years that went into leading up to this day today to our members from New York. And with that, I will turn it over to Mike Lawler. And thank you for putting this press conference together today. Thank you.
Thank you, Chairman Wenstrup, and thank you for your leadership on the Select Subcommittee with respect to the coronavirus 19. All of us from New York know full well Andrew Cuomo is a phony and a fraud. Andrew Cuomo, at his directive, the Department of Health issued that memo, and he put our most vulnerable population at risk, resulting in the death of over 15,000 seniors. And it was Andrew Cuomo who covered it up. It wasn't just the directive, which was bad enough and idiotic, and resulted in the death of the 15,000 plus seniors. It was Andrew Cuomo, for political purposes, who directed the state government to cover up the death toll. It was Andrew Cuomo who had a blood money book deal, making millions of dollars for himself at the expense of New Yorkers, who misused and abused New York State government and government resources to write this book, despite his nonsensical lies today before the committee that he wrote the book all by himself. We all know what happened. We all know what Andrew Cuomo did. This is the same guy who now is decrying cashless bail, congestion pricing, and New York's sanctuary state status. He's the one who signed cashless bail, congestion pricing, and declared New York a sanctuary state. And yet he decries all of this. He's a liar, he's a fraud, and there's a reason he's a disgraced ex-governor. His conduct is unbecoming, and despite his best efforts to clean up his image and potentially try to run for office again, The reality is there's a greater likelihood of the Tappan Zee Bridge being renamed than Andrew Cuomo ever holding office in New York State ever again. And it is because of his conduct and because of his behavior with respect to the COVID-19 pandemic and what he did. And so I appreciate Chairman Wenstrup and my colleagues, Chairwoman Stefanik and Nicole Maliotakis, Nick Langworthy, and everybody who participated in today's hearing to hold Andrew Cuomo accountable. And with that, I turn it over to Chairwoman Stefanik.
Thank you so much, Representative Lawler. This day has been a long time coming. Each of our offices have heard from constituents who have lost loved ones resulting from Andrew Cuomo's fatal directive issued on March 25th regarding our nursing homes, forcing nursing homes to take positive COVID patients. So today's deposition was a step in delivering accountability and delivering long overdue answers to those families who are still mourning the loss of their loved ones. A few highlights from the deposition today. The deposition began with former Governor Cuomo's lawyer adamant that I could not ask questions since I'm not a member of the committee. What we informed her, and I informed her, was that I was going to ask questions as chair of the House Republican Conference, waving onto the committee, and like other New Yorkers, ask questions on behalf of my constituents. The former governor called Democratic staff members conspiracy theorists, bizarre, obsessive, when it came to Democrat staff questions regarding Cuomo's team cooking the books when it came to testing numbers. In addition, under my questioning, former Governor Cuomo admitted that the New York directive language on March 25th was not the same language as CMS guidance, despite his public attempt to point fingers and blame CMS to try to blame President Trump. In the deposition, he admitted that the language in the March 25th directive was not the language in CMS. In addition, he smeared Tish James's report as overly political. He smeared Kathy Hochul, who was serving as his lieutenant governor at the time. When asked about his staff's inappropriate behavior and smearing of nursing home families who lost loved ones, he did finally admit that that was unkind and not appropriate. He also went so far as to say that his senior staff, when they suggested other members to lie on depositions, he made it a point to say suggesting to lie is not perjury. So he is complicit to obstructing justice. At the end, after hours and hours and hours, I asked him, does he apologize to these families? And finally, he said that he already has. And I said, does he have accountability? And despite hours and hours of trying to blame everybody else, in the final moments of the deposition, he said ultimately, as the New York governor, there is accountability for how they handled nursing homes. This is an important step. We're going to continue doing the important work of this select committee. And with that, I want to turn it over to Congressman Langworthy.
Thank you very much, Chairwoman Stefanik. Today, as New Yorkers, this was a critical day towards accountability, as the Chairwoman stated. Upwards of 15,000 families never got the appropriate opportunity to say goodbye to a loved one as they perished in a nursing home. They weren't allowed to say goodbye because an overzealous governor, drunk with power, changed the law so they could no longer communicate with their loved one in their last hour. The March 25th executive order, it defied any logic why you would bring COVID-positive patients back into an environment where the governor himself once said it would run through there like a flame through dry grass. He lacked empathy, he lacked apology, and he lacked accountability. That's my takeaway from sitting there since 10 o'clock this morning. Everyone else is to blame, namely the federal government in his eyes. But this was so important today, and I thank Chairman Wenstrup for making this a possibility and giving New Yorkers the opportunity to ask for accountability. People like the family of Janice Dean, who lost not one but two of her in-laws in the same fashion in nursing homes. But without this, we never would have gotten answers from this governor. I think there is more to come. because the way he abruptly left office under a cloud and scandal unrelated to COVID with sexual harassment, we never got the opportunity to hold him accountable for these drastic, terrible actions that led to so many people losing their lives and so many families not having answers. So thank you, Chairman, for what you did, and thank you for your leadership.
I'll now ask Representative Malliotakis, a member of the Select Subcommittee.
Well, thank you, Mike Lawler, for hosting this press conference. As a member of the Select Subcommittee for the last 4 years, we have been trying to get answers from Governor Cuomo about what occurred. What was the information they based their decision on? And to hear the governor stonewalling for the last 4 years, and then come before the committee and tell us that he did not know that this directive existed, that he did not authorize it, that his Department of Health commissioner did not authorize it, that somehow it just popped up from an unknown staff member at the DOH. That's very, very difficult for anybody with common sense to believe. The governor, who is hosting daily briefings, who was in the minutia of all the numbers and all the figures and all the things that the state was doing in response, has no idea that this March 25th directive mandating nursing homes to take COVID-positive patients existed. Until a month later, he claims, when the media asked him a question about it. Does anybody believe that? It is outrageous to think that a governor that was so obsessed, so micromanaging, does not know that this type of mandate came out of his administration. So right there, you have someone who is trying to deflect, someone who is trying to point fingers. We've heard to all our questions today. It was either this lowly staff member at the Department of Health who is unknown. We don't even know who it is. Think about that. The governor finds out about this directive that kills thousands of seniors a month later, and he did not do an internal investigation to find out who this lowly staff member, who's still unknown, who that person was. That, to me, is unconscionable. And if anybody believes that, I've got a Tappan Zee Bridge to sell you. But the truth is, he spent all day deflecting and pointing fingers. If it was not that staff member at the DOH, then it was the CDC and the CMS. It was their guidelines, which, by the way, different wording. That was not a mandate that came from CDC and CMS. That was a suggestion. It was a guidance, but no way a mandate. Then he blamed the nursing home, saying, well, it was their fault if they couldn't care for them and they should have rejected them. But it doesn't say that anywhere in the directive, that you had that opportunity to reject someone if you could not care for them. He tried to blame President Trump. He tried to blame the state legislature for things. Everybody but himself. He refused to take responsibility. And that is why our committee will continue to do our work. We will continue to speak with people in the administration. We'll continue to expose the lies and the discrepancies and the flaws of what occurred. And we won't let up until we get to the bottom of what occurred here, because we owe it to the families. And Elise brought up a really important point. When asked whether he would change that directive now that he knows about it, he said no. He said no. He actually said he would communicate about it more. He would explain it more, but he would not actually change it. And therein lies the problem. And that is why we saw thousands of New Yorkers die unnecessarily in a preventable tragedy.
Thank you, Congresswoman Malliotakis. I'll now introduce my colleague, Congresswoman Claudia Tenney.
Thank you, Chairman Lawler, or I should say Chairman Wenstrup, and all of my colleagues here, especially all those who were able to attend the meeting today. Unfortunately, I was unable. I served in the state legislature before I was here in Congress, I came in with, as a freshman with Nicole Malliotakis, my colleague now in Congress, and we fought years to try to expose the corruption of Andrew Cuomo, the meanness of Andrew Cuomo, the micromanagement, the terrible policies, the corruption, you name it. Just about everything bad that happened in New York was because of Andrew Cuomo. I remember very distinctly when this order came into play in early April, I received a call from one of my constituents, at the time not a constituent because I wasn't actually serving in Congress. I was a former member of Congress candidate to be a new member of Congress. And she contacted me, lived next door to a nursing home in my district, and said, this is an unbelievable situation that's happening. We are watching ambulances drive into this nursing home and hearses coming by to pick residents up. And that was the first that we had the sign that something was happening in our communities. I immediately contacted some of the nursing home directors that I knew from my former time serving on nursing homes. And they indeed confirmed everything that was said today by my colleagues, that Cuomo did order this, and there was no way out. They were threatened, they were intimidated if they did not take these nursing home patients, in spite of the hospital patients with COVID-positive patients. In spite of the fact that other options were available to Governor Cuomo, the Javits Center was not full. Other options with the Comfort ship coming into the harbor in New York. All of these options to keep citizens, especially seniors and vulnerable people, out of harm's way were not used by Andrew Cuomo because he's an arrogant, corrupt, uncaring person who ran our state, unfortunately. But this is a real tragedy, and these people deserve justice. So many people died needlessly in our community, particularly in mine, and all across the state. We even have a colleague, a former colleague of ours from Nicole. The county executive of Rensselaer County actually issued an executive order prohibiting Cuomo's executive order from operating so that COVID-positive patients could not be placed in nursing homes in Rensselaer County, and therefore he saved hundreds of lives in that case. It was impossible otherwise to really fight against Cuomo. He used all kinds of extortionary methods to remove dollars from communities who didn't live up to his mandates. And now here we have a terrible tragedy. And I'm hoping at some point in this Congress that my bill, the Essential Caregivers Act, will get passed. Everyone, I think, behind me is a sponsor of this bill to give the justice and the care and the dignity that all of these people deserve in the future if we ever should have a pandemic. And God hope we don't ever have a tyrant and a malicious person in office like Andrew Cuomo that sent all these people to their untimely deaths. With that, I think and then Congressman D'Esposito.
Well, thank you very much, and Chairman and the Select Committee for today's hearing. You know, the issues that we're talking about and the decisions that Andrew Cuomo made shouldn't be looked at politically. The people who died, their families are looking for answers because the decisions that he made were inhumane. It's not about being a Republican or a Democrat. It's about being a New Yorker. And Andrew Cuomo has spent his career pointing fingers at others, placing the blame on others, not just this decision with regards to the nursing homes and COVID-19, but much of his career. And we see it now as the city and the state is unraveling in his decisions over cashless bail and criminal justice reform. He points the fingers at others. And thanks to the Select Committee, today was an opportunity to point the finger at Andrew Cuomo. And COVID-19 was a devastating time. But Cuomo took it as an opportunity to host a daily talk show. He took it as an opportunity to write a book and make money. He took it as an opportunity to not only destroy small businesses and main streets throughout the state of New York, but destroy young children's opportunity at education. And he also took the opportunity to destroy lives. And today was a step in the right direction of him being held accountable for that. And I hope the questions asked today to Cuomo continue. Because I remember back to those days of COVID-19 when I was still a member of the Hempstead Town Council, and we ran in the town of Hempstead our own municipal. We ran a municipal cemetery. And I think back to the days with families calling our offices because there was a waiting period in order to be buried because there was so many bodies coming out of nursing homes. Think about that. Nursing homes running out of body bags. No areas in cemeteries that the staff there didn't have the ability to legitimately dig graves quick enough. Those are the questions, and that's the accountability that thankfully we are one step in that direction today. So thank you again to the Select Committee. Thank you to our conference chair. And I really do hope that today is the beginning of many more questions and fingers pointed right at Andrew Cuomo. Thank you.
Thank you. Brandon Williams, New York 22nd District. You know, the COVID-19 pandemic was an unprecedented crisis. And with that, Governor Cuomo took unprecedented power and claimed unprecedented power. And with that power, he did unprecedented and unnecessary harm. And the people of New York, the families of the loved ones demand an answer today. Mr. Chairman, thank you for the important step of holding Governor Cuomo accountable for the incompetence, and even worse than the incompetence is the indifference. And to all the families that suffer today and that suffered through that because of these terrible decisions, I hope that you find solace, that we're demanding answers, that we're shining light in places where Governor Cuomo has taken unprecedented steps to cover up, to dodge, to weave, and to hide. And those days are over, and we're bringing accountability as the people of New York, as the people of Central New York should expect from their government. Thanks very much.
Thanks, Brandon. For the 2 years during our response to COVID and the economic shutdown imposed on New York and states across the country, I served as a county executive. For clarification, in New York, that means that I oversaw the public health response to COVID-19 in my county. I was on the calls with Andrew Cuomo's staff. I was on the calls with nursing home administrators. I was on the calls with hospital administrators. I had to make the decision to buy body bags and mobile morgues. We had to conduct the autopsies to prove cause of death. We had to assemble and organize vaccination stations and testing sites. I had to make the calls to families who didn't understand why they couldn't attend their loved one's funeral. We had to explain order after order after order by Andrew Cuomo and his administration, which over time were not only not related to anything to do with common sense, but were not supported by science. I had the benefit of sitting in today, and Chairman Winstrup, thank you, and to my colleagues on the committee and those who have shouldered this important responsibility. New Yorkers are grateful. Andrew Cuomo knew that health department order was issued. He knew that the health department order was altered. The Albany Times-Union reporting today clearly that it was the governor's administration that amended the Department of Health order to make it clear that nursing homes could not reject and could not decline admission of individuals with COVID. He then went further in his press conferences to threaten nursing homes, saying to them they had no choice. At the same time, his administration used the power granted him by the state legislature, the only governor in the country to be given the complete and autonomous authority to craft law. State legislature handed it over to the governor. He said to nursing homes and hospitals, you must follow these instructions, because if you don't, these organizations knew that their licenses and their livelihood would be threatened. There was no question that they had to follow the order. Today, the governor wants you to believe that he didn't know about the order, lie number one. That he didn't put any pressure, nobody did, on nursing homes and hospitals, lie number two. And that they had no such effort of covering up or altering the total number of deaths, lie number three. He went as far as to say, again, which he said in public, and so I feel very confident and comfortable saying it to all of you again today. He doesn't, when confronted with the fact that nearly or more than 9,000 individuals died in nursing homes in the state of New York, his administration, in an altered report, reports 6,400 deaths. He says, what does it matter that another 3,000 died? It's not connected to anything except this. It's connected to his order. There was an intentional effort to drive down the data so that there could be no correlation between an order that he knew nursing homes shall receive individuals with COVID, New York demanding no testing of those individuals when they were returned to nursing homes, and likely ultimately leading not only to the loss of their lives, but to other lives. He knew it. They altered the data so that there could be no correlation between an order that led to the loss of lives. This isn't about blaming Andrew Cuomo. This is about demanding accountability for people who lost loved ones. And I'm a 30 years member of my volunteer fire department. If this was a structure fire in my community, we would have a public after action review. This was a global pandemic that led to enormous infringement on civil rights, the closure of businesses, and decisions that early on made sense, but as we learned more, made no sense. Of course there needs to be transparency. Of course there needs to be accountability. And for the thousands of lives lost and their families, there needs to be a reckoning. I'll just close by telling you that in April of 2020, as my father took his last breaths, isolated in a hospital in the state of New York, I was at the time grateful for those who stood and were with him. But once we understood the nature of the decisions the governor was making, there is no excuse for the families who had to be on the other end of a phone listening to their loved one gasp for the very last time. I will never forget those last 5 minutes I had with my father. I don't hold Andrew Cuomo accountable for the death of my dad. I do not. But I hold his decision-making responsible for putting other lives at risk and ultimately diminishing the value of those lives and treating the decisions as part of a publicity stunt and profiteering for a book nobody bought. Thanks.
Thank you, Congressman Molinaro, and especially for sharing, obviously, a deeply personal story with respect to the loss of your father. Before we open it up to questions, I just want to read a statement from an organization that has been at the forefront of holding Governor Cuomo accountable, Voices for Seniors. Quote, for years, grieving families have begged for answers as to why our loved ones died from COVID contracted in New York nursing homes. During Cuomo's daily briefings, he would update the daily numbers of the newly hospitalized and deaths, while stating there would be a hospital bed shortage rather than using resources such as the USNS Comfort and auxiliary hospitals that were provided by the federal government. They went unused. Meanwhile, the Cuomo administration forbid nursing homes to test for COVID. The federal guidance did not suggest putting COVID-positive patients into nursing homes, but New York guidance did. In addition, Cuomo's administration illegally used state resources to write a book beginning as early as March 17, 2020. As if all of this isn't damning enough, COVID nursing home deaths were intentionally omitted from public health data used to make real-time health decisions, resulting in an untold number of deaths. Early on in the pandemic, the numbers of those who died mattered to Cuomo. But as questions arose, the numbers were hidden. Cuomo asked, who cares? We care. Voices for Seniors is comprised of members that represent every race, religion, gender, and political ideology. The preventable deaths of our loved ones is not political, and we resent and denounce Andrew Cuomo for using our pain as a political attack against our elected officials doing the jobs we have asked them to do. Our loved ones' deaths are not a, quote, MAGA conspiracy theory, as Cuomo's spokesperson claims. Democrat committee member Dr. Ami Bera described it best when he called what happened, quote, medical malpractice, end quote. We are hopeful we will receive the accountability we rightly deserve and justice is done for our loved ones. Without answers, how will we be able to avoid this from ever happening again? And with that, we open it up to any questions.
Mostly for Chairman Wenstrup. I think that if Republicans didn't have the majority, today's hearing never would have happened. First, do you think that's a fair assessment? And second, why was this a priority for you to make happen before the election?
Well, to the first part of your statement, this never would have happened if we didn't have the majority. It just wouldn't have. Democrats clearly had a chance to do this last term. It didn't happen. I am pleased to say that today in the hearing that my colleagues from the other side of the aisle were pretty sharp on their questions too, especially from the medical side. And what the things that are inexcusable are certainly highly questionable. So again, I don't think it would have happened if we weren't in the majority. And this is not the last step. You know, we take what was said today, we compare it to what we know to be fact and reality, and compare some of those things. And very likely, we will ask the governor to come back in front of Congress again. It's not only just the people in New York that deserve this; they do, but I think the whole country does as well.
All right. Thank you, folks. Appreciate it. Thank you, Chairman.
Excellent job, you guys.
Thanks. Thanks, Mike.
Yep. Thank you. Good job. Very good.
Thank you.
Nate.
How are you? Good to see you in person.